Hello friends, today we are going to see about Mrs. Sadia. She is an 27-year-old female and measured blood pressure is 110/7. Pulse that is normal 106. RBS means sugar test which is not mentioned means that not the matter of concern. SpO2 means oxygen levels that is nearly 100%. And as the condition is mentioned that she is suffering from cold, sneezing and short carry. So let's see the suggested medicines. First one is Steptoe, which is an antibacterial antibiotic released from bacterial infections in the region of lungs and soft skin tissues, and given for eliminating any bacterial presence in air surface. Second one is Vorticetine, used for allergies and given for sneezing, and it also reduces saliva. The third medicine is Fentanyl 40, which is an proton pump inhibitor, used to treat acid reflux, heartburn by controlling stomach acid. The last one, fourth tablet, Post-Rap, is a combination of ibuprofen and paracetamol, which helps in reducing pain and swelling, given for throat pain and reduces swelling that may block the air buttons. The fifth medicine is a cough syrup, SULS, helps in breaking pulse and helps making the air clear